I'm Greg Durm, and I'm a medical oncologist at the Indiana University Simon Cancer Center, and I've been practicing since 2016. So I became a doctor for a lot of reasons. One, I grew up in a family full of nurses, and I had the opportunity at an early age to see the impact that they had on their patients' lives and the impact that those patients' lives had on theirs. And that coupled with an interest in science and math, I became interested in becoming a doctor very early in my life, and that's just persisted through all my experiences, and that's how I got here today. So when patients meet with me for the first time, it's usually just a chance to get to know them, to learn about their story and how they got to where they are today, into my office. Usually we talk about the symptoms they first had, going through the tests that they've already been through, explaining what those mean just in case that's not been answered for them. And then ultimately we decide if there are any additional tests that need to be done before we can talk about a treatment plan. And usually we like at the very end to sort of summarize everything so that they have a nice plan of care going forward, and they're not left to wonder what the next steps in their care are. So what do I love about my job? I mean, the biggest thing I love about my job is the patients. I love sitting in my office, talking to people, getting a chance to be a part of their lives, hear their stories, and to try and help them in any way that I can. A part that people may not know is that I do some research, particularly clinical research. So I get a chance to add to the data that we have to come up with new treatment options for our patients and to help patients live better and live longer. So those two things together make my job really quite enjoyable. So when I'm not seeing patients, I really like to spend time with my family, my wife and kids. I have a lot of relatives that live here in Indiana. I grew up here all my life. We love to do things that are outside. We love to play sports. I love to just sit and read. Basically anything that's fairly low-key, I'm up for. And we like to spend a lot of time with friends, going out to dinner in Indianapolis and the surrounding areas. So that's pretty much what I spend my time doing when I'm not here at the hospital.